it's a term that, often is thrown around as kind of a throwaway term, or not a definitive term, and it has more recently been recognized as a definitive term, as a diagnosis, if you will. And I think it boils down to physicians being cynical and feeling low sense of accomplishment, depersonalization, not recommending the profession to their kids or their friends, retiring earlier than physicians would have, or change careers more often or more so than our predecessors. So that's kind of what it feels like when it's happening to you. I'll answer it in a percentage more than just an absolute number. But for the last 5 or 10 years, the number has been thrown out there. The percentage that's been published is about 50% of practicing physicians are burned out. Unfortunately, during this last year and a half of the COVID-19 pandemic, that percentage has increased, even now with some early reports from research being done on physicians during that period of time. So a pretty high percentage, a high number of the several millions of doctors practicing in the United States. And I was very interested to learn that it's not the same for everyone. I mean, even in a hospital system, one group of factors that contribute to their burnout might be different than ones that are on a different floor of the hospital, which kind of thing, which I was new information for me. But I think that the way I conceptualize it is, right now in the 2021, for the last 10 years, there's never been a group of physicians prior to that were exposed to the same factors that we are. And I'm not saying, we're less resilient or more resilient. Older physicians are getting burned out as well and have been for a long time, but it's kind of a perfect storm. There's more, demands to see more patients, and, pay is less. There's much fewer number of private practice physicians now. Most of us are employed by a larger organization, so there's this loss of autonomy. And then kind of the rules and regulations, the amount of things that we have to document that many of us feel aren't related to actual patient care, that detracts from our ability to have face-to-face time with our patients. As Colleen mentioned, we don't see other doctors as often, like in the old days when we'd go to the hospital more often. And so it all kind of contributes to like I say, this loss of a sense of worth and accomplishment of what we all went to medical school and aspired to be, these caring, giving, helpers of the community. There's definitely been a loss of that, and all those factors kind of accumulating right now to, like I say, 400, 500, whatever the real number is of physicians in the United States, so that gets so despondent that they actually take their own lives. That is, significantly higher than that of that same number of physicians in the general population would be. So, and it's gender related. Female physicians are even more vulnerable to burnout and suicide than their male counterparts. So I'm hearing myself talking. I mean, you can't just put your one finger on it. It's just an accumulation of factors that has, got us where we are today.
And I'll just add a little bit. I mean, it's also hard to know how much of these characteristics drive someone into medicine in the first place, like this sense of a tremendous responsibility and care for the work that's being done. I mean, you see that across the board with physicians, really having this high level of expectations for themselves, for the work that they do, and how that might be contributing. Again, just this sense of Dr. Mick Krasner and Dr. Ron Epstein have written a little bit about sometimes this mismatch between, again, being called to a certain type of work, and then not being able to balance it out with the other aspects of your life, like work-life balance. If you hold this huge responsibility, how then do you balance out the other responsibilities in your life? And this comes up, I mean, we could see it in medical education as well. Like just getting people food is a big part of well-being, when it comes to people either in medical training, residency, and then as physicians. The other thing we know is that physicians aren't always good at seeing doctors themselves, at getting routine checks. So there sometimes are high rates of cancer, even coming out of residency programs, which it sounds surprising, but people just might not be getting screened appropriately, and then having something more challenging by the time it's actually found. So I think there's a lot in the mix, as Dr. Pauly pointed to, that's contributing. And then this, Dr. Pauly already named it, but many people go into medicine to help people, and then not being able to have as much control over time or autonomy, especially as medicine has shifted quite a bit and less sole practitioners out there. It's more and more expensive and difficult to do that. And so it can feel like a loss of control or autonomy as well.
Burned out physicians are, less productive, more likely to make a mistake, more likely to be, have a malpractice suit filed against them, more likely to leave the position that they're in, and the cost is very high. To replace a physician that leads an organization probably is in the range of between $500,000 and $1 million when it's all said and done. Not to mention the disruption to the practice, the patients having to find a new physician and so forth. And then the worst case scenario is that the depression or the burnout turns into depression, and then suicide, the symptom of depression. So that's really the magnitude and the seriousness of what it is that we're trying to approach.